Okay, so it's about a minute after 9, so I think we'll get this show started. I know some people will join us in process, but I think that's fine. I'm Manson Locke. I'm from the Human Resources team here at Unity, and it's my great pleasure to be able to introduce this Zoom session for today. So the Zoom session is live and available for all of our staff, and it's going to be recorded. So if you have a colleague and they hear the buzz and they want to see it, please let them know that. So I guess we could say back to school this September is complex, and that might be the most massive understatement of the century. So parents like me are struggling to manage this time, and we're bombarded with facts and probably more opinions than facts about what it is we should do. So I think right now we're having the opportunity to harness the fact that we work at a great place like Unity, because only at a place like this, in such a short turnaround of time, could we assemble a panel of experts to have a chat with us, colleague to colleague, about what the actual facts are and what professionals in the medical profession have to say about this current time. So not only do we have colleagues that are knowledgeable in their fields, but we're lucky to have colleagues also that have collaborated with their peers at Sick Kids in drafting the foundational guidance for school reopening plan, and has been the basis for a lot of the policy work that I know is shaping our day-to-day decisions. So I'll do a quick introduction of the panel of experts we have with us. First, we have Dr. Justine Cohen-Silver. She's a pediatrician practicing at both St. Joseph's Health Center and St. Michael's Hospital. She's the school clinical lead physician for St. Joseph's Health Center and the director of research at St. Joseph's Hospital Pediatrics. Dr. Sloan Freeman is a full-time pediatrician at St. Michael's Hospital Inner City Health Program, assistant professor in the Department of Pediatrics at the Faculty of Medicine at the University of Toronto, and lead for the Model School Pediatric Health Initiative for Unity Health Toronto, and is the partnership of the TDSB. And Dr. Kevin Schwartz is an infection disease physician and department head of our infectious disease department, the Department of Medicine. And if you look at his profile, you see he's done a great deal of work also with Public Health Ontario, and he'll speak from that perspective. So just because we know from recent town halls, there winds up being a lot of questions for HR and occupational health and safety. Cheryl Crouch and I are here as well. We're going to attempt to proactively answer some of the main questions that are asked. And also you have access to us quite a bit at town halls and can ask us a question almost anytime we have a town hall. We hope with your questions that you submit will be for our panel of experts who are lucky to have access to here. So quick housekeeping. Each of our speakers will take about 5 minutes or so to talk a little bit about their perspectives and expertise with respect to back to school. We've received a great deal of pre-submitted questions. We've spent some time thinking about how we can respond to those, and we're going to go through those, and then we're going to open up the chat function. So you'll be able to submit a question through chat. You can promote the question by liking it and giving it a thumbs up, and we'll go through those with what remaining time we have. So that's all I have to say by way of introduction. So I'll turn it over to Dr. Cohen-Silver to kick us off.
Good morning, and thank you very much for this opportunity. I'm really looking forward to having this discussion today, and I hope it's helpful. So we've decided to just go right ahead and start reading through some of the questions that have been asked, and we'll start answering them up front, and then if there's time at the end, we can explore more discussion. So the first question that was asked is the following. I understand that masks are encouraged, but otherwise optional for children in junior kindergarten to grade 3. Would the presenters recommend younger children wear masks to school if they can? My daughter is 5 years old, starting grade 1 next month. I have concerns about the realities of mask wearing for the youngest students. Some of my concerns include dirty masks being put back on, wet masks sitting on faces for hours, touching and pulling at mask face, and tolerance of the masks. I'd appreciate your opinion and the opinion of the panel now that the TDSB is suggesting masks may be required for all grades. So I as well have a daughter who's entering kindergarten this year, and she's very excited because she doesn't realize all this noise around her. So I'm encouraging that, of course, and we can't wait. And I think that the best answer to this question is truly that it depends on your child. You know your child best. You will know if your child would be able to manage the developmental steps that are required to maintain a mask. That would include hand hygiene prior to putting the mask on, not touching the mask when it's on, taking it off by the ears and not touching it when it's removed, keeping it a safe distance from the face while doing other things, such as, I mean, while eating really would be the only time you take it off, hand hygiene before putting it back on. So it's just important to remember that children are wearing masks for source control, to protect other children from them. The idea of the mask is not that it would be protecting them necessarily from other people, but more that they are preserving their own droplets and they are not sharing them with the class. And so when wearing a mask, we want to consider all of the strategies that the guidelines have suggested and consider that hopefully they will all be used together to minimize risk of passing on COVID and other illnesses. And some of these strategies include screening and not sending your child to school if the child has any symptoms of illness, frequent hand hygiene, physical distancing, cohorting, cleaning, and ventilation. And so I think we just need to weigh this all together when we're deciding if our kindergarten age child or a child that is young would tolerate or be able to maintain a mask. And I think the answer for me is I don't believe my daughter will be able to manage. I'll definitely try my best, and certainly if it's required, we will help her to do that. But I'm in the same boat as you, and I think it's a risk-benefit balance. Thank you.
Okay, thank you, Dr. Cohen-Silver. I will take the next question, which is very similar to the first question. So there will be some redundancy in the answer, but it says, my kindergartner is willing to wear a mask, but is almost certainly going to fidget with it like crazy and will take it on and off multiple times per day. Is it better off just skipping the mask and focusing on hand washing and physical distancing? So again, this is a really good question. We want to highlight and focus on the bundle of measures in place. So it is not one more important than another or one in lieu of another. It is really the bundle and the combination of measures that are keeping our children safe. As was already mentioned, the mask is meant for source control. But if you think there is maybe a theoretical risk of increasing your child's risk of transmission by wearing the mask because they will be touching their face often, their hands may not be clean, and they may be taking their mask on and off. And if this poses a theoretical risk to your child, then it may be appropriate for them to not wear a mask and to practice the other measures that will be in place in the classroom. So I hope that answers in part the question.
So the next question on the list is a human resources question. So I'll jump in on that one. So the question is this: in the guidance document, it states that parents and caregivers need to be empowered by their employers to be able to take paid sick days and or work remotely if their child youth are not able to attend school. How will Unity Health Toronto be supporting employees in this regard? In the case where a child is symptomatic and caregivers need to stay home with their child, will these be counted as sick days, vacation days, or in a separate category? How will this tie to the attendance management program? So the report does state that employers and government play a critical role in supporting parents and caregivers who need to stay home. So I think we know that, and I think we've been saying that Unity Health does have a role in supporting parents. And particularly in cases where there's an unexpected shortage or lack of childcare because there's a closure or requirement to quarantine, or you have a child that's symptomatic. From a government perspective, I know that the suggestion was the government could step in. The government did make amendments to its emergency leave policy and legislation And the purpose of this was to ensure that workers in Ontario who encountered this situation where they had a sudden need to be away from work had job protected time away from work, that this would be an allowable leave of absence under an emergency situation. The government, when they revised this legislation, however, did not make that a paid leave of absence. So that's important to, to know that it functions like other emergency leaves. And if you recall, there were paid leaves of absence, and those were revoked in recent legislative changes made by the government. What's further, when we talk about paid sick time, are the short-term disability plans right now that are called HUDIP that are available across Ontario hospitals cover circumstances only where the employees themselves are sick. So where you have, and this has been the situation for a while, a child or a loved one, you need to provide care for them, they are legitimately sick. Unfortunately, the short-term disability plans do not pay you for that time. So what does this mean for employees who experience these absences? So really what we're finding, because we are in conversations with parents now about needs to provide childcare, and we're finding that people's individual circumstances are very different. So we're asking staff to contact their manager. You'll have the confidence of knowing that the emergency leave provisions do apply to you in these circumstances. And we're working with managers to have the best toolkit possible to be able to support you with the time off when it's necessary. So we'll look at accumulated entitlements like vacation and lieu time to try to do compensation preservation for you. We've looked at remote working situations. We've looked at part-time employment, job shares. There's a whole variety of things. I think what I'll just reiterate is that before, our employee population is highly diverse, and I think that's reflected in a wide array of childcare options and approaches that families choose to take. And so we think that the best approach is a highly individualized approach for each employee's situation. And then a really short answer to the second question, which is attendance management. If I'm off because of this, will it go against the attendance management counting of thresholds? And the answer is no, it will not apply for the attendance management program. Okay, thank you. On to the next question, whoever that is.
Okay, I guess perhaps over to me. So I'll, before we read the question, I mean, I just wanted to start off with a few comments, introduction, and just to deal with, I think, a common issues that come up, common questions that come up related to schools. I mean, first off, I just want to say thank you to everyone, not just for joining and indulging us today, but for really everything that you've done, not just as healthcare workers, but as part of the public in terms of the public health measures that everyone here, but across society has done and has sacrificed to try and control this pandemic, which has, over this time, which has been very challenging, has also been very successful. And I realize that this is a challenge for everyone, including, all of us. And there's also a bit of a disconnect between what we've done over the last 6 to 8 months and what's being proposed going forward. And, and the reason for that is just to, I think, help clarify, is that when this initially started, we really took an elimination strategy, right? We really needed to try and control the virus to much as possible. And initially it was to try and get rid of the virus. We're into what we call a mitigation strategy, which is not possible to eliminate COVID-19. There was a nice op-ed done from some colleagues of ours written a couple weeks ago, and they referred to this as the hammer and the dance. The hammer was the big public health measures. We're shutting down society, we closed schools, really everything stopped, and we completely physically distanced from each other. That is not sustainable, and it is not the goal going forward to continue the hammer. We've been very successful. Community transmission rates are low, and we're moving into what's called the dance phase. Which basically means that we need to reopen parts of society, but we need to do this dance with the virus so that we control and limit cases and outbreaks that will and are going to occur to some degree. And that's what the goal is going forward, to keep community transmission low. And the goal of low community transmission is in part to safely reopen schools, which is absolutely essential and critical for the well-being of children, to allow people to work, for society to function, for our kids to grow and learn. So it's absolutely critical that schools open. And what we can try and hopefully outline is how this can be done safely. But just to reiterate again, that the most important safety measure to do for opening schools is low community transmission, and we need to, the rest of us need to continue to do our part in physically distancing and other public health measures to keep community transmission rates low. So with that, I think the next question I'm happy to read and answer. Here. I have a child in kindergarten returning in September. We are aware of the suggested recommendations to have taught our child as much as we can about hand hygiene and masking, and we're hoping for the best. However, when our child started JK last year, colds and flus were almost constant throughout the first year. My questions are, how should schools be dealing with children who display cold, flu, COVID symptoms? Should students isolate at home for 2 weeks every time they become symptomatic? Yeah, so it's a good question. So, I mean, the first part to answer that is that the array of public health measures, which we can talk about in more detail, but which are outlined in both the Sick Kids Guidance document and the guidance put forward by the province as well as the local school boards, all that package of material of guidance is meant to reduce the risks of viral transmissions within the school. It's not specific to COVID, right? They apply to all respiratory viruses in the way that they're transmitted. So if done appropriately, we should see reductions in viral disease across the board. Now, it won't be eliminated, but it hopefully will be reduced, and hopefully we won't see the extent of viral infections that we previously seen, especially when kids start school for the first couple of years. The answer to the other part of the question is, do children need to isolate for 2 weeks every time they become symptomatic? No, I mean, that's not what's going to happen. I will say that there is guidance that'll be coming out from both the province, but also from at the local level, will be coming out in the coming weeks in terms of what to do in different scenarios. The symptoms of COVID-19 overlap with other viral respiratory illnesses. It's important to know that, I mean, they cannot be differentiated by anybody, no matter your expertise, because there is overlap, and COVID-19 in children tends to be very mild. So the most important take-home points are that if your child is symptomatic with possible viral respiratory symptoms, that they do not go to school. Okay, there's going to be forms or screening to be filled out at the beginning of each day, or just your own. Every school board will operationalize this differently, but if your child has symptoms, they should not go to school. At that point, there'll need to be an assessment done by either the parents or the physician about whether or not COVID testing is indicated, and that really depends on the scenario and the symptoms. If COVID testing is not indicated, or is negative, in general, it'll be once the child is well for 24 hours, they can go back to school. Now, again, that depends on what the diagnosis and the symptoms are. If a child is positive for COVID, so they have COVID symptoms, they're tested for COVID, then you follow the advice of public health. And in that scenario, that's when there is a period of isolation at home when you can't go back to school. The duration, again, is going to be changing all the time. Currently, it is 14 days, and that's where the 14 days comes from. But that's specific for confirmed COVID positive patients. Okay, and then the next one is I think is back to Manson, part B of that question, which I think you perhaps already answered, but I don't know if you want to read that, or you feel it's adequately answered. Let me read it out and we can answer it.
Yeah, I've got it here. So, and what does that mean for parents who then need to be home to care for children who are isolating? Will children be expected to have swabs done when they are symptomatic in order to rule in out COVID? likewise for parents, would they need to be constantly testing? So the first part, I think I covered sufficiently about the supports that would be available at Unity for people that are experiencing this, the opportunity for permitted time from work under the emergency leave. And then the question about swabs, Kevin, did you have a perspective on that?
Yeah, sure. So, and so, what I alluded to in the previous response. So, that COVID-19 cannot be clinically differentiated from other viruses. So in the context of, let's say, fever and or cough or new runny nose or sore throat, loss of taste and smell. I mean, there is a list of COVID-19 symptoms that overlap with other viral respiratory illnesses. And in general, if a child has that constellation of symptoms, because they need to be not going to school, and then depending on the symptoms, will need to be consideration for testing. There's not going to be a role for testing of asymptomatic children and teachers and other people for the most part, unless otherwise advised from public health. But it's really about symptomatic testing, and symptomatic testing will be helpful for one, identifying outbreaks early so that public health can deal with them and stop them from spreading. They will allow children to go back to school quicker if they are COVID negative. So there is going to be an important role for testing of symptomatic kids when schools are underway, especially if community transmission increases to levels above where they are right now. Next one over to Justine.
Okay, sounds good. Thank you very much, Kevin. So I just hope to emphasize as well the thought that currently community transmission rates are low, and that I just want to commend public health generally for having had such excellent measures, and for all of us following their suggestions and doing a great job at flattening the curve. And because of this, we're at a good point right now where transmission rates are low, and it's considered to be safe for children to go back to school, or relatively safe. And for those reasons, I really do personally trust public health to let us know when transmission rates are on the rise, and it may be better to start pulling back with some of the things that we've been doing, getting out and about more. And I really believe that we've been doing a good job, and our public health system has been doing a good job at guiding us. So I hope that is of some comfort to the other parents out there today. And with that, here's the next question. I have a question about the guidelines around kindergarten age children, having one child going into JK and one going into SK. So that's a busy house. With the curriculum primarily play-based, do the guidelines change for this particular young group, given they will have a more difficult time distancing, wearing masks, no desks in class, etc.? So I hope to go over a few points with this answer. One of them is just that the guidelines were not determined based on the fact that children in kindergarten are going to be play-based. We were more considering just their developmental stage and ability, and also some other facts. So so evidence within the guideline I'm going to be quoting here. Multiple reports from around the world indicate that children and youth account for less than 5 to 10% of SARS-CoV-2 symptomatic infections. That partially has to do with the fact that we have been keeping them home, so it is yet to be determined. Rates probably will go up when children go back to school, but generally speaking, 5 to 10% of children account for all of those infected. As well, children seem to be less likely to transmit the virus to others. There is some evidence around that. So in the context of that, I hope to revert back to our original thought and the purpose of the guideline, which is just really considering the well-being of our children, the future generation, who are going to be growing up at this time that COVID has now entered our world and is not going to be leaving for a while. And just considering their development, mental health, and the importance of that, and trying to get them back to school. So we will still recommend that all of the measures that the guidelines suggest are put in place as much as possible, even in a play-based setting. So perhaps the way that the children are going to play, the teachers are going to have to determine, is there a way to do this while indoors, while physically distancing, maintaining hand hygiene, ensuring adequate environmental cleaning and ventilation. And the masks, plus or minus, there has, as far as I know, there hasn't been a confirmation yet from, for example, the TDSB that masks are going to be mandatory, but they may be mandatory as well for children in kindergarten age. However, we do feel if those other measures are in place that we are minimizing risk as much as possible. They don't interchange each other, they don't replace each other, but they will help. And that children should play, that it's very important that we allow them to play. There's a lot of good evidence around play-based learning and the good opportunities this provides our children that we cannot underestimate. So I am going to trust the school board to make good decisions to enable that to be done safely. But I think that it still should definitely be done. And just to emphasize as well, and we did say this in the document, outdoor play is recommended. We recommend that when one is playing outdoors, when children are playing outdoors, that we can consider it to be safe, even without a mask, that it is quite a safe way to engage. And for this reason, I have since enabled my children to have play dates outdoors this summer, and it's been amazing to see the effect it has on their mental health, actually. So not to be underestimated. A couple other points, I just want to look at my notes for a moment, and then I'll pass it back to Sloan. So just a reminder that Kevin has said already that the most effective intervention is for us to try and follow public health guidelines to the best extent we can to really minimize the risk of increasing the community transmission rates so that we can have our kids back at school. And in fact, we talk in the guideline that if things should need to start closing down because transmission rates are increasing, that the priority should be the closure of non-essential congregate settings, such as bars, for example, and to really try and prioritize school as much as possible. So I hope that answers the question, and I will pass it on to Sloan as well.
Thanks, Justine. So the next part of this question is the following. As a parent, I'm trying to wrap my head around the following. Since March, we have been practicing physical distancing, wearing masks, and hand washing, both at home and at work, with many parents working from home and continuing to do so. How is it all right to send children back to school to 30 children in a class with no available room for physical distancing and no ventilation? So this is a good question. And I think it really goes back to the analogy that Kevin provided for us of the hammer and the dance. So we had the hammer, which was strict community guidelines around staying home and not, practicing social distancing and not going out to work and obviously closing schools. But now it's time for the dance and to go back to school. But we are not suggesting that children should go back with no measures in place. Certainly, we have advocated for and continue to recommend the bundle of measures, including cohorting in smaller cohorts, physical distancing, absolutely still recommended, as well as mask wearing for some children, depending on the school board, and hand washing. And of course, screening, so that no child is sent to school with symptoms. And as has been mentioned so many times, doing our part as just citizens in the community to keep community transmissions low so that schools can stay open for as long as possible. So we do advocate for all of these measures to be in place when schools reopen. But I think we have to get our heads around the fact that because community transmission is low right now, it is time for this dance, and it is time and appropriate for schools to reopen and start to get back to some semblance of a new normal. So I will hand it back to the next question.
That's me. Okay. Next question. If I am contacted by public health or my child's school/daycare, and they tell me that they have been exposed to a child who has tested positive for COVID-19, what am I supposed to do if they are asymptomatic? What if they have symptoms? Yeah. So again, I mean, there's no single answer for all of these different scenarios, right? But the main answer is to follow the advice from public health. In the event that there is a case in the school, and especially within your child's class, you'll be contacted from public health and or the school about what to do next. And what public health does is a risk assessment to determine if there is a significant exposure, if it's a low risk exposure or a high risk exposure. And depending on the exposure risk is what they will advise you about what to do, whether or not your child may be able to continue going back to school and you continue to monitor for symptoms. The child and someone who is a high risk contact may be asked to self-isolate at home for a period of time and or be tested. It really quite depends on the extent of the interaction. And certainly in the scenario where there is an exposure and the child develops symptoms, public health will recommend that they get tested and isolate in that time. So it really depends on the nature of the exposure and the role of the public health nurses, and there's more being rolled out to be assigned to every school, is to do that assessment if and when there is a case within a school.
Good morning. I just would like to further add to Kevin's point is a lot of people are coming forward asking, can I bring my child to the CACs at St. Joseph's or the St. Michael's site for testing? The answer to that question is yes. So the St. Joseph's Health Center CAC, which is the COVID Assessment Center, will provide testing for children of the ages from 1 and up. And the St. Michael's site will provide testing for children at ages 3 months and older. So just so you know, that service is available at both the St. Mike's and the St. Joe's site. So the second part to this question that's come forward is, if my child's school, daycare, and or public health notifies me that my child has potentially been exposed to a positive COVID person, but your child is asymptomatic, not known to be positive, and not identified as a close contact, what am I expected to do? So what we have done is we have developed a reference document which is going to be posted on the COVID Micro site. It'll also be distributed via our regular communication channels, which is Leadership Links and Twice a Week, RX Twice a Week. And it goes into various scenarios as what to do in the event that you are contacted and what the expectations are. So this document, just to remind everybody, is a live document and is going to be changed just like things were throughout our COVID experience. As Kevin mentioned, there is going to be some new documentation coming forward. So of course, we will update the document accordingly. So for this specific scenario, the best case scenario for your child is to consult with the local public health authority. The school may also be able to provide some information for you and also your family physician on how to best care for your child and how to treat your child at home. And usually that's, I don't know how to describe it, but usually that's home remedies basically regarding COVID illness for children. We would ask that you monitor your child for symptoms. So that would be looking at your typical COVID symptoms, taking temperatures twice a day, and also looking at the atypical symptoms too as well. If your child does develop symptoms, we ask that you contact our COVID tracing team. So that is located at the St. Joseph Health Center, but it provides services across the Unity Health. The phone number is 3737, and it will be available in the reference document too as well. If you are calling that number outside of the St. Joseph site, you would add 13 in front of that and then 3737. That team will provide support to you and direction on what the next step should be. And they are available 7 days a week. We would also ask that you continue to come to work. And should anything change regarding your child's status for COVID, that you contact us again to give us an update, and we will provide you further direction as to what the expectation should be. So you would still be able to come to work and work your regular shift as scheduled. And just a reminder that we're all wearing our PPE at work, including our mask and our face shield when providing care to patients. I'd also like to add an additional point at this time is to strongly recommend that you consider vaccinating your children for influenza. So COVID also mirrors symptoms of influenza. So this is an excellent opportunity for do some research and decide if you would choose to vaccinate your child this year. It will help probably to ease some of your minds as, does my child have influenza or do they have COVID? So with the vaccination for influenza, it should help to alleviate some of those concerns and should be able to assist with your physician if you need to consult with your physician regarding your child's care. Thank you.
Let me just reemphasize, sorry, 2 points from Cheryl that influenza vaccines are going to be so important for children this year. So that is a really great point, and it's going to minimize school absences, minimize the need for COVID testing, and protect others around them. So a really important point. The other, which is one of the most common questions that I get, which Cheryl alluded to, just to emphasize, is that contacts of contacts do not need to be isolated. So if your child is a contact of a case at school, but is not symptomatic and is not COVID positive, you do not need to isolate as the parent because you're a contact of a contact. It's too far removed and it doesn't spread that way. So you can continue to come to work and you can continue to do your normal routine unless your child becomes symptomatic and or confirmed positive for COVID, and then you're now actually a contact. And then the management's different. So I wanted to try and clarify that because it's a really common question.
Great. Thanks, Cheryl. Thanks, Kevin. So the next question is over to me. So the question is, I have childcare available to me, but I have concerns about sending my child to school, and I'd prefer to stay home with them and support them in distance learning or in a learning pod. Will I be entitled to be excused from work to support my child in this way if it is my preference to do so? So as probably most people have noticed, although COVID cases in Unity have gone down, we have not gotten any less busy. We are actually entering a pretty unprecedented period of clinical volumes and pressure right now. I think we've got the competing pressures of trying to do the very best we can for our patients now in our clinical recovery and to get people critical health services that they haven't had for some time. And we also need to prepare very proactively in case there is a second wave. So it's still a very busy time. I think we learned during our response to COVID that we always sort of knew healthcare workers were essential, but we really was brought home to us as a concept as during this time when the whole world seemed to be hunkering down in their homes, healthcare workers continued to get up and go into work and work very, very hard through this whole period. And I think that essential nature of healthcare employees is going to continue into September, despite the fact we are now faced with new decisions about our children and really tough things to navigate about what's the best thing to do for our children. So I think it should be probably of no surprise to people. There is an overarching expectation that staff will still report to their scheduled shifts, will need to avail themselves of available childcare opportunities or try their very best to find alternatives that they're comfortable with. And of course, that's your right as a parent to find the most appropriate arrangement for your children. If parents are making plans to stay home, they think that that's going to have impacts on their ability to report to scheduled shifts. I think we've said this before, we'll reiterate it. We'd be asking that you'd engage as soon as possible. I know that from discussions with management and leaders across the organization that we want to work with our staff as best as possible to support them in what they feel is necessary. But I would also say that Unity does count very much on its employees to be able to care for our patients. I would suggest you not count on that as a guarantee that you'll be able to be relieved from your very important duties here caring for our patients, but we'll engage with you and we'll work with you on solutions if they're available. And over to whoever's next.
Okay, I think that next one's back to me. So do you have any recommendations around children and visiting grandparents as we return to school? Yeah, so it's a good question. I mean, and the short answer is there's no one right answer. I think it really depends on different scenarios, right? So, I mean, I would say in general, children should probably not be visiting grandparents in long-term care, or retirement, or congregate settings. And that's really just to protect not only particularly vulnerable parts of the population, but also all the other non-relatives that are there as well, which is is a very challenging setting of elderly, vulnerable people in close quarters. I think there's going to be scenarios, for instance, multi-generational homes, where it's obviously not realistic to make blanket recommendations that children cannot see grandparents once school starts. And I think, coming back to this again, it really is dependent on community transmission and the overall risk. The risks of COVID going forward is never going to be zero in any scenario, but as community rates are low, the risk is at present very low. And if they remain around these levels, it's going to be very low. And I think everyone's going to have to make their own sort of personal decisions about what they feel comfortable with. Even if I tried, I'm not able to stop my mother from hugging my children. But I wish the best of you luck if that is your choice. But I think it's and in all seriousness, it's really about individual risk and individual circumstances and health of the grandparents. Part B to this question is, what should be the protocol if a child/teacher tests positive for COVID-19? I mean, I feel like we answered that before, but essentially it is to follow the advice from the public health nurses that will be contacting you in that scenario, and especially if the child is deemed to be a contact of that exposure.
Okay, so I'm going to read the next question for two reasons. One, because this next question is a bit of a round robin of all of our panelists, and two, because this is actually my question. And so I'm going to read this one. So both of my children are in elementary school, and I'm thinking about the first day of school, thinking about it a lot. I would like it if it would stop moving, but I'm thinking about it a lot. And I would like to know, like, what one piece of advice would you offer to me as the most important when I'm preparing my children to start school? Just pretend I'm a forgetful person. I'm only going to remember one thing. What's the one most important thing you'd give me as a piece of advice? We'll start with you, Justine.
Okay, thank you so much. It's a great question. So I think I would suggest, Manson, to not be afraid and to definitely role model a positive attitude about school. Your kids are watching, and you just want to show them that hopefully you're as excited as them to start the school year. My children genuinely are excited to see their friends and get back to some semblance of normalcy. And so I'm going to be role modeling that I really am positive about it. We're packing their bags, we're getting ready. And in the context of that, I am going to practice masking with them ahead of time. We've gone over it many times. Someone once recommended doing it during screen time, which for my son wouldn't be fair, to say the least. But I think masking, practicing hand hygiene so that it's part of the normal routine, but overall just being really positive and role modeling that. And good luck to your kids.
Thank you, Justine. Sloan, over to you.
Thanks, Manson. Yeah, I would agree. I think, look, if we've made the decision to send our kids to school, we need to be confident with this decision and positive about it, because we want our kids to feel positive about school. And, if I could just take these couple minutes to highlight the important role schools play in our children's lives beyond their role in education and learning. Schools are so vital, right, to our children's social, emotional health, physical and mental well-being. And schools promote this by providing routines, consistency, physical education, but most importantly, schools provide a community of peers and trusted adults that our children feel connected to. So it's really this central role in enabling and promoting in-person socialization that is so key to our children's development in every domain, right? So when we think about the risks of attending school in person, we also have to consider the risks of not attending school. And this balance, this equation is unique for every family set of circumstances and unique to each child. So that's my advice. And I'll hand it over now to Kevin.
Thanks, Sloan. Your turn, Kevin.
Yeah, thanks. And I mean, at first, I just want to acknowledge that this is obviously a challenging time for everyone, and these decisions have been stressful for everyone having to do with school, and there's a lot of mixed information that's floating around. I do want to reemphasize, completely agree with Sloan's comments that school is critical. Like, school really has to open. Children have to be educated and have to go back to school, and that it does involve some social interaction. I think the most important thing that we can do individually and collectively is to keep community rates as low as possible, and that will ultimately keep schools as safe as possible. I am sending my kids to school, if that helps anybody with their decision, and I think we, and I think there will be a number of measures in place in an attempt to minimize the transmission. Again, the goal is not to eliminate any and all cases that will occur in schools, but that our system has the capacity and is set up to identify those quickly, contact trace, control any limited outbreaks. And so really important to keep your kids at home if they are ill, and to consider testing if they have symptoms compatible with COVID-19.
That's great. Thanks, Kevin. So we've reached the end of the questions that were pre-submitted to us. And what we're going to make an attempt to do is, I think we have about 10 minutes left of our dedicated time for this session. So what we're going to do is we're going to go to the Q&A, and we're going to attempt to answer some of the questions that you have submitted. If you have a question, please submit it. If we don't have time to get to it in this session, we'll endeavor to put together a brief answer and share it with you after the fact. But Evelyn is going to give us a hand in going through some of these questions and curate them a bit so that we can really make our panel work.
Thanks, Vincent. So by way of quick introduction, my name is Evelyn Zhang, and I'm the Manager of Corporate Communications. And as Manson mentioned, we've received some questions through the Q&A function. And you can find the icon at the bottom of your screen. And you can also upvote questions, as you mentioned, by clicking on the thumbs up. And that'll help prioritize the questions for us. So over to the first question. A lot of parents are asking if children with asthma should be excused from wearing masks. Dean, Sloan, Kevin wants to take this one.
You want me to do it?
Sure.
There is not any specific medical exclusion for wearing masks. People with asthma can wear masks, and they can wear it safely. There is no harm that comes with it. I would say that if the child feels uncomfortable in the mask, especially if they are very young, it may not be worth trying to force the issue. And so I wouldn't say there's a blanket recommendation that children with underlying pulmonary disease cannot wear masks. I think it really depends on the child and whether or not they feel uncomfortable wearing it is more of the issue.
Great, thank you. And another one for you. It's been upvoted 3 times. What is this one is not for you. What is Unity Health's stance for employees who work in non-clinical roles and spaces and who decide to keep their children in a remote learning environment starting in September? Does Unity Health support working remotely in these instances? That's probably you, Manson.
Yeah, and it's a tough question to answer because, there is generally a policy approach when you think about remote working and remote working policies for an organization. And generally the policy approach, and this will be included in our new policy when it's rolled out, would be that remote working is not a solution for childcare and elder care. And speaking as a person who has done a reasonable amount of working at home with 2, as I mentioned before, elementary age children, I think there's a really good reason for that. And it's not just the mental health of the parent, although I've learned that that's a factor as well. But I think I go back to what I said earlier in that we're going to have to actually partner with employees and work with them on their own individual circumstances and attempt to find solutions that will work. And that will depend on the nature of the work, the ability for it to be performed at home, whether you have 10 children or 1 child. I think there was a variety of factors that would go into that consideration. So, there's the normal policy approach, but we are in a unique circumstance. And I think the only real solution is to work directly with parents on their individual circumstances and see what we can make work.
Thanks, Manson. Okay, this one is for Dr. Schwartz. If a child gets tested and they're negative, can they go back to school? And what about the incubation period? Are we worried that they may have it, but at the time of the test is negative?
Sure. So I mean, perhaps we can just sort of quickly run through a few scenarios, because again, it depends on what the scenario is, right? So for instance, if a child is a high-risk contact to a case and public health recommends that they get tested even though they're asymptomatic, they could test negative and still be within the incubation period. And in that scenario, though, the guidance from public health would be to continue to self-isolate until the end of the incubation period in the scenario of a high-risk contact. In the scenario where a child is symptomatic, so they have symptoms of a viral respiratory infection, and they test negative, most likely that they have a different viral illness. And in that scenario, they cannot just go back to school because they still have another contagious viral illness. But as long as they're symptomatic, they need to stay home until their symptoms have resolved for 24 hours. And then, you know, the public health advice will be that in that scenario, then they could go back to school. So in that scenario, the incubation period doesn't factor in because there's no known specific contact to COVID-19. So testing, yes, is a point in time. And yes, testing can be negative, especially in the context of asymptomatic testing. But in a symptomatic person, a negative test at that point in time is quite reassuring that the child doesn't have COVID. No medical test is 100%, but I think that is reasonable because it's likely to be a different viral infection. Hope that answers the question.
Great, thank you. Another popular question, how worried do we need to be about transmission from surfaces such as backpacks, school clothing? Should children change out of clothes as soon as they get home? Should backpacks be washed every few days, etc.?
I'd be happy to try and answer that question, and then I'd be happy to also ask if any of the other panelists would like to add to my answer. So I think that relatively speaking, the chance of transmitting COVID-19 from a surface to you is quite low. Generally speaking, it is transmitted by droplet, as we have discussed. And for that reason, I think that it is quite a low risk that the COVID-19 would be on someone's backpack and would continue to live on it. That said, there is some evidence out there about different surfaces and how long it has remained on them. So what am I going to do, I guess, is the best way to answer this question. I think that I would consider my kids changing their clothes when they get home from school. And I think I will consider cleaning their backpack once a week, but perhaps I will keep their backpacks by the door and not have them bring them into the bedroom. But that said, for a lot of these things, we are kind of making it up as we go. I don't think that that's necessarily the best answer. It's what I'm going to do. And I would say, though, overall, I believe the risk is very low for COVID-19 to be on their clothes or backpacks. Does anyone else want to add anything?
I'm sure I can jump in. So in general, fomite transmission, right? Indirect transmission is not the predominant route of transmission. We do see fomite transmission in contexts like hospitals or long-term care facilities where there's large burden of disease, many positive patients, and lots of contaminated surfaces. In that scenario, it is more of a significant risk, which is why we focus more on environmental cleaning and other measures in this context. In schools, it is not going to be like that. There's not going to be burdens of many or dozens of active cases at the same time is not going to be the scenario. I don't think it is necessary that children need to change their clothes and sterilize backpacks and that kind of stuff at the end of the day. There's not going to be massive burdens of virus, and it does not survive probably for very long, especially when there's a small amount of virus. So I do not think you need to be, my general advice to people is that you don't need to be wiping down groceries. I don't think you need to be wiping down backpacks. You don't need to be changing kids' clothes like they're healthcare workers when they come home. Because it's a very different scenario. And so I think that is not going to have an impact. I would wash their hands when they come into the house. And I think that's probably adequate, in my opinion.
And I think we'd almost have to think about, like, how would that even occur for a child to become infected from, touching their backpack? Someone would have to have gone to school with an asymptomatic infection, somehow gotten a significant viral burden from droplets onto the backpack. That backpack would have had to come home. A child would have had to maybe touch it in that exact spot, bring that to their mouth. I think it would be a very, very unlikely scenario for a child to become infected from a backpack. So I agree. I won't be washing my children's backpacks or clothing after school.
So I think we have time for just maybe one more quick question, Evelyn.
Sure. Last one, if a member of the household, a parent, a grandparent, or other caregiver has symptoms typical, atypical of COVID-19, but this has not been confirmed and the child is asymptomatic, should they stay home from school?
Take that. um, so, okay. So, if it's a contact of a non-confirmed case that is asymptomatic, no, they do not need to stay home from school. The important take-home points is children that are symptomatic need to stay home from school. If somebody has symptoms of COVID-19, they need to get tested, and then depending on the test results will determine what to do. And again, in terms of the there's an incubation period to consider here, right? So if, let's say, someone in the home is positive, is symptomatic and not known to be positive, they should get tested. If the child is well, they can keep going to school, because there's going to be a period of time, even if they are positive, the other person, until the child would even potentially be exposed and infected and contagious to others. So it's the important take-home point is not to worry too much about all these different nuances, but that symptomatic children need to stay home, and symptomatic individuals should be tested for COVID. And then from there, you follow the public health advice.
That's great. Thank you very much. So just a couple closing points. Just want to remind people that this session was recorded. So if colleagues weren't able to join us, they can find it on the intranet. And that I apologize that we didn't get to all the questions. Obviously a great deal of interest here. So we're going to endeavor to try to provide responses to those questions at a time after the webinar. But mostly what I wanted to do is say thank you to Dr. Freeman, Dr. Schwartz, Dr. Cohen-Silver. They were willing to come on this in very, very short notice and be subjected to a array of questions, which I really appreciate the answers to. And I really do feel like I stumbled into the lunchroom at work and just happened to find two pediatricians and infectious diseases experts sitting there, and you were able to answer all my questions. It was a great chat, and I really appreciate it. I just wanted to say thank you very much on behalf of myself and all of our staff who I know had this need. So thank you very much, and I hope everyone has a wonderful day.